Okay, we're live. Welcome everybody to the Facebook Live. My name is April Watts. I'm the Manager of Communications at the Foundation Fighting Blindness. I am joined today, luckily, by Dr. Kevin Anderson.
Hi guys.
And we are at the Shops of Angus
Glen Optometry.
There we go. That's where we are. And Dr. Anderson is a co-owner of this gorgeous establishment. And he is we're going to be talking to him, it is Vision Health Month, so we're going to be talking to him about some vision health tips, ways to keep your eyes in good condition, and he's also going to walk us through what an eye exam looks like. So first of all though, I wanted to know, how often should people get their eyes checked?
Very good question, because a lot of people don't know that. Really, seniors, at 65 and older, and also younger kids, 19 and younger, are covered by OHIP every single year. So, no charge, doesn't matter for insurance or anything like that, so they should be coming every year, more frequently if recommended by their healthcare professional, but should be at least every year. Then for the sort of middle healthy population, should be really every 2 years. Sooner if there's a problem, or if you're a contact lens wearer, it should really be yearly, because that's an extra level of health risk to the eyes that needs to be assessed yearly.
Gotcha.
But no more than 2 years.
So then, like, say for children under 10 or something like that, is there a difference, or is it just 19 and under just come every year?
19 and under.
Yeah?
Mm-hmm.
Okay, cool. Awesome. There you go, y'all. You should be coming every year.
There's no excuse not to.
Exactly. Awesome. So, Kevin, we'll take a walk through. You can
Sure.
show
You want
us.
to have an eye exam today?
Yeah.
All right.
Let's do it.
So what we do first, we need to get a little bit of information about the patient. So really, when you go to a doctor's office and you have to do the annoying thing where you sign a form and fill out that information, that actually is really important to us, because we need to know about you. We need to know what you do. What's your lifestyle? Do you have kids? Are you out in the sun? Do you fish? Do you go up to the cottage? Are you in front of a computer? All this stuff matters, because that dictates kind of other things that we need to test in vision health. So by this point, if you were a new patient here, I would have a form kind of know a little bit about you. So it knows you're down at the Foundation Fighting Blindness, you're looking at the computer, you're on the phone a lot. Your vision needs are going to be different than someone who's, let's say, a truck driver or a pilot or IT. So all that stuff makes a difference. Medications, everything, because the eyes are connected. So it's all very important.
Right.
So April, we're going to have you have a seat here first. So in a typical eye exam, the first thing we need to do is gather a little bit of basic information about the eye. You always want to be clean and sanitary, just in case, because we have a lot of patients flowing through here. And the first machine that we're going to use here, not to get too technical, but this machine checks the front curvature of the eye and the length of the eye. So this is looking for abnormal astigmatism, abnormal curvature. It does give us a little bit of an idea about your prescription. So a lot of people think, oh, I had this, there's my prescription, I'm done. No, this just is a start of that.
Okay.
But this will also, as it's shooting light into the eye, we can also see early cataracts. We can see all kinds of weird stuff.
Alrighty.
So, now that this is dried off, I'm going to have you come forward and just put your chin right in the chin rest there. And very important, just give me a few good blinks. There you go. And you're just going to look straight ahead, and you're not going to feel anything. This is just using the light rays to go in the eye. So no radiation, no lasers. And
I'm looking at a hot air balloon.
You're looking at that hot air balloon. And the balloon's going to get a little bit blurry. Perfect. And you're going to blink a couple of times. And we'll just do the same thing in the other eye. Excellent. And you can sit back. Did you feel anything?
Nope.
Did that hurt at all?
It did not hurt.
Piece of cake.
And the picture is quite lovely, actually.
Kind of wish you were off in that.
Yeah, totally.
So we're going to come over to this machine next. And different doctors use different techniques to do this. We use this one. So this is called the puff test, as I like to call it.
Ah, yes.
You had the puff test.
Do they still do the...
We still do it.
Yeah.
So one of the screening tests that we use for glaucoma is to check the pressure of the eye. And that's what this does.
Gotcha.
So it doesn't hurt. You're just going to feel a little puff of air that goes into the eye. And we'll have you put your chin right in that chin rest as well. And I did clean this one before we came in.
Excellent.
So this time, no pretty picture. I'm sorry. But you're just going to look at that little red light right in the middle. Oh, sorry, green light right in the middle.
Thank you.
And you're going to feel a little puff of air. Just like that. The worst part is you know it's coming.
I know. It's like waiting for toast to pop up.
Yep, waiting and waiting. Same thing over here. Beautiful. And you can sit back. Fantastic. So you survived.
I did.
So now we've got some information about your eye, and we're going to take that into the exam room.
Okay. Come with us. would you like those?
So I have April, our patient, have a seat here.
Okay.
So we're going to take that information that we obtained in the other room, and we're going to plug that into our little system. And different eye doctors have different equipment. Sometimes you just have the ones where you have to manually do the wheels. I like this because I can sit back, don't have to strain my shoulders, and it's a little bit more accurate.
Yeah.
So touchscreen, digital, it's sort of, we're in the digital age now. So then, we've got the measurements from the front of your eye. So we're going to come over. This is called a phoropter. And you'll notice you're only looking out of your right eye.
Yes.
Very important to check each eye by themselves. This is how we pick up lazy eyes and things like that in kids. So we're only looking out of the right eye. And April, I'll just have you read those letters if you can.
SBHCZ, whatever.
Perfect. And how about those?
KORDH.
And don't forget to blink your eyes. And now I'm really going to make you work today.
Oh. I was like, you went by those really fast. I was like, I really hope I don't have to read those ones.
You'll be testing this later for memory.
ONRKD.
There we go. And normally what we would do is we would use this machine to kind of focus on one letter. And then it can make little adjustments. So you see how this got a little bit blurry?
Yes.
And then this is where the infamous which is better, 1 or 2 test comes in. And everyone thinks there's, I'm freaking out, I can fail this test. You can't fail the test. So we would do the right eye, and then we would jump over and assess the left eye as well. Can you still see that letter there?
Yes. It's an H.
And what happens to the H when I do this?
It's blurrier.
A little fuzzy.
Yeah.
A little better here.
Yes.
And the neat thing about this machine is I can say, okay, so right now, if you actually had a prescription pair of glasses on, that's how those letters would look. And you can see all those. If I take the prescription away, this is how your vision is without glasses.
Gotcha.
And then we can even say, here's just the right eye, here's just your left eye.
Gotcha.
Did you notice anything about that left eye?
Yeah, it's blurry.
It's a little blurry.
Yeah.
Does that left eye get a little clearer when I do that?
Yes.
We'll have a talk about that later.
Interesting.
And then we can also, for those fun over 40 folks, we start to lose our reading vision a little bit. That happens to everyone. And then we'd check your reading vision, and we can also determine if you need reading glasses, bifocals, all those things.
And so that's a really important thing too, right? Is to check each eye individually, because each eye, like, they overcompensate for each other.
Very much.
Yeah.
And I can't emphasize that enough. So a lot of parents out there will say, okay, well, my kid sees the board fine, the teacher's not complaining, he's at home, he can see the TV, he doesn't need an eye exam. And then sometimes they'll come in here and we check both eyes together, they're fine. But then when we isolate each eye, they'll go all the way down the eye chart, but when we go to the other eye, they go, what happened to the letters?
Right.
So you can have a lazy eye, and kids aren't going to come out and say, oh, this is blurry. They're going to say, I can see, and teachers are being trained to pick this up now, based on symptoms. But if you have a kid that's perfect in one eye and horrible in the other eye, they're going to be sitting there looking normal. And everyone thinks a lazy eye, you're going to see the eye turn or something. Not necessarily.
Right.
In early diagnosis of things like the foundation is looking for, their vision's going to be fine, but you never know when there's little symptoms. There has to be damage for their symptoms, so we're looking to be proactive in that.
Right. And then the same thing with AMD as well, right?
Yep.
Like our age-related macular degeneration. The sooner you catch that, the better, so that it
100%.
doesn't go to turn into wet AMD.
So it doesn't progress. Right. I mean, I've got a lot of patients that have early dry macular degeneration. They're still 20/20.
Right.
They're perfect.
Right.
And people think, oh, that's a disease of old people, and if you're out in the sun a lot, not necessarily. I've had lots of patients just this week in like late 30s with a particular type. And there's a bunch of different types, but early detection is key.
Awesome.
So to segue into that, so after we kind of see where your vision is as baseline and we're determining your prescription, then, and I'm not going to do this to you today because it's probably Sunday day and you have work to do.
Yes.
But we would normally put some eye drops
Right.
in the eyes. And the important thing about those eye drops is, even though it's really annoying and people would say, oh, it's so bright outside, it's very important for us to have a good look into the back of the eye. You can see fine, but we say 20/20, it doesn't mean that the eyes are healthy. And so we put the drops in, and after about 15 or 20 minutes, the pupil, that black hole in the eye, it's really big. So then we've got a nice big window to see everything in the back of the eye. We're looking at the retina. And that's, when you think about the eye as a very complex camera, there's a lot of stuff that can go wrong. just
Yes.
unknown, limitless amount. So we need to see all of this. We also need to look at the lens in the eye, everything from front to back. From something as simple as just a slight prescription to something as severe, and I've seen this before with brain tumors. We can see that looking in the eye. And I've seen 4 in my career, 3 of those were asymptomatic. We just came in, I think I need glasses maybe.
Right.
We found some bad stuff going in the eye, which we got them to a neurologist and down to sick kids and things like that. So very important. People always think, I see just fine. My eyes have to be healthy. Not necessarily.
That's why it's so important.
Very important.
Right?
So then after your eyes are nice and big and buggy,
Yes.
then we would use this machine called the slit lamp. It's basically a glorified high-tech magnifying lens. Plus it looks really scary.
It does.
So I would have you come forward.
Okay.
Just put your chin right in here. And you can blink whenever you need to. So this is giving us even more information about the health inside the eye, the blood vessels, the retina. And just to give you a little preview, I'll have you look right at my ear there. And very important, think happy thoughts. So even though we don't have your eyes dilated,
I was going to say, can you see anything?
we can still see a lot actually.
Yeah.
I can see your retina right now.
Creepy.
I can see your optic nerve. See all those blood vessels back there. And this is why, so doing an eye exam, the middle part of that population, you know, the quote healthy population we were talking about earlier, there are certain instances where OHIP will cover the eye exam.
Right.
Let's say if you are diabetic. So if you're diabetic, you can have leakage in the back of the eye. It's very similar to macular degeneration, and it can damage the eye in the exact same way as wet macular degeneration. It all has to do with leaky blood vessels in the back of the eye.
That's DME, is it?
That's it.
And what's the full
Well,
name
there's-
for that acronym?
Well, there's diabetic macular edema,
Oh, right.
and there's DR, diabetic retinopathy, and there's a whole bunch of subclassifications. So a lot of family doctors will have their patients come see me because even though their blood sugar is okay, you know, due to the standard,
Yeah.
they need to know is that healthy for them. So we'll see patients come. My blood sugar is perfect. It's 7. It's right where it needs to be. We look in the back of the eye and we see little tiny leaks in the blood vessels, and that tells us 7 is not good enough for them. They need the sugar to be lower. So then we're co-managing with the family doctors as well. So
Gotcha.
very important, and that's one of a billion things that can go wrong.
Oh,
So yeah, it's kind of scary stuff.
indeed.
And then, so the back of your eyes look beautiful, by the way.
Yay.
And then there's deep breath.
Yeah.
And then there are more things. And you know, when you're going to see your regular eye care professional, we also have machines that can scan the back of the eye. So some places will have a retinal camera. You can take a photo and actually show you what the back of the eye looks like. There's something called an OCT. Stands for optical coherence tomographer. And I hope you're writing all this down.
Of course. I will memorize that.
So an OCT is more in depth. It's kind of like a CT scan for the back of the eye. And it uses infrared light, and it actually can show us the layers of the retina. So when I'm looking in the back of the eye, I see the retina in 2 dimensions. It's like me looking down at the floor to see how the carpet looks.
Right.
Okay. What the OCT does is it does these little slices. So it would be like I can actually get down, lift up the tile, and look underneath and see what's happening. This is becoming the gold standard in diagnosis and treatment of macular degeneration, because when I'm looking in the eye, there are these little early thing called drusen, you know, those little yellow splotchy things in the back of the eye. If I don't see that, I'm assuming no macular degeneration.
Right.
But if you send someone for this OCT, it goes beyond that. We can actually see those little particles underneath the retina as they're starting to come up. So we can see macular degeneration a decade before we can see it clinically. And
Wow.
again, always goes back to early diagnosis is key.
That's amazing.
So this would be this little dip right here. This is the back of your eye, like if you were looking at me.
Right.
So all the light rays go into your eye and they focus right on this sharp point. This is the macula. So the macula is our central sharp vision. So a normal macula should be like this. Nice little dip, nice and smooth. Someone that has wet macular degeneration, this is a scan of that exact same spot, but you don't see that dip, and it's all wavy, and you see all these little holes in there. So all these dark holes are where there's bleeding. So there's separation in the layers of the retina. This person has no vision, or severely damaged vision.
Right.
And you can also see that this little membrane is peeled off in the back of the eye. So this obviously we would be symptomatic for, but someone that has just a few little early spots, they can see just fine. I'm 20/20, but we can pick it up doing this scan.
Gotcha.
So this is progressing to become part of every eye exam, you know, to do that, because we're looking beyond the surface.
For sure.
So very important.
And so with this as well, so when it comes to wet AMD, do people come here to get because there is treatment for it?
There are treatments now.
It's injections into the eye. So do they come here? Like, do they come to an optometrist to get those injections?
No. So the
No?
optometrist, we kind of act like the primary care doctor of the eyes.
Yes.
We sort of like your family doctor. You go in, we see problems, then we would sort of route you to the proper specialist. So
sure.
an ophthalmologist, a physician, surgeon, would have to do the injections. And
Gotcha.
so there are general ophthalmologists, but then there are also subspecialties. So retinal specialists would be one that, because it has to be a very controlled, very monitored
Precise,
environment,
yeah.
very precise, because you're
Right.
talking about someone putting a needle into the eye to
Yeah.
inject this material that's going to soak up that blood vessel back there. So they have to be monitored pretty much in a hospital setting.
Wow.
But that would be a retinal specialist.
Yes. Okay. Wow. Cool.
So there you go. Here's the eyes
It's
101.
very cool stuff. Yeah. And notice he's got the Foundation Fighting Blindness on the back of his
Absolutely.
background for his computer. He's on it.
Doing a lot of work.
Yeah.
You guys are awesome.
Yeah, we are.
Yeah, you should teach on one for that. Make my job easier.
I know. Well, so the thing is, actually, we can talk about this a little bit right now, is that Kevin has been heavily involved in Cycle for Sight for a number of years. He's actually co-chair.
Co-chairing, yeah. with Mitch this
Co-chair.
year.
That's how I met Kevin years
Yeah, I
ago,
believe
back
you
in the
recruited
day.
me.
I recruited him. I'm glad I did. But you actually have a whole family that's involved that comes out, rides with you. They volunteer.
We do, yeah. Nephews, brothers-in-laws. Yeah,
absolutely. So it's great. So maybe you could just tell us a little bit more about Cycle for
About
Sight
Cycle for Sight?
this year. And
Well, this is kind of a big year. So this is the big 10-year anniversary, right? So we've been around for 10 years. And this year this is our second year going out of Creedmoor Springs Brewery. Those guys are amazing. They shut down the whole main street for us. And we've been lucky the last few years. This will be my sixth year riding.
Okay.
And it's kind of, even if, and the first year I rode, I had ridden a bike maybe twice.
Right.
Like I'm not a cyclist.
Yes,
but,
yes.
my brother-in-law, Fazal, said, hey, we should do this. And so I said, yeah, it's a good idea. And so it's nice because there's 50 kilometer, 100 kilometer, and 150. So it's kind of something for everyone. For like the novice, it's it's a beautiful kind of rolling route. So we had kids 14 and 15 years old out there, and we've had people like well into their 70s and everywhere in between.
For sure.
And the thing that makes this cycle unique is that it's geared toward, obviously raising money for research, to fight blindness.
Yes.
But we actually have a large group of people who are visually impaired or partially sighted that ride, because we have some amazing donors out, at Craig Leith, the cycle club out there that have to bring 10 bikes. And so just because you're partially sighted, this event is for partially sighted or people that are afflicted with these diseases. And it's amazing how much they're coming out and they're saying, look, I'm not going to sit back and wait for something to happen. I'm going to go out there. I'm going to be a visionary. I'm going to ride for the cause.
For sure.
So you can actually ride with a sighted captain,
Yes.
riding the bike, and then kind of get the full experience. And all the proceeds go toward Foundation Fighting Blindness and raising money for research. But it's an amazing ride. It really is the perfect one-day ride.
Yeah.
I mean, when you come out and see all the volunteers, you have people that, it's a beautiful day on a weekend. They got other things they could be doing, but they're really dedicated to this cause. And it's something that means a lot to me, and that's why I keep coming back. It's, you see the same people year after year, and sort of that
And it's like a
badge of honor.
reunion, eh?
It really is. I want to see new faces this year. I always constantly want to bring, tell a friend, bring more people on.
Totally.
And it's only, you have to raise $600 to ride.
Yeah.
$600. Call a few friends, and some people even host parties, little sign-up parties and whatever. And there's all kinds of fun little things you can do. But it's really sort of that sense of community and just enjoying the ride. It's healthy.
Yeah, it's good for your
Can't beat it.
eyes.
Good for your eyes.
Staying active is good for your
Staying
eyes.
active is good for the eyes, as long as you're wearing the proper sunglasses and protective eyewear. Yeah.
Actually, maybe we can go talk about that.
Sure.
About proper
Let's talk about
UV stuff.
Yeah, now that we're finally getting some sun here, this is
Yeah.
amazing. Yeah, summer is upon us.
Indeed. Alrighty. Lead the way.
Let's go to the front here.
Cool. I don't know where to go.
We've actually been quite busy lately, so we're a little bit low on the sunglasses, which is good. Once the sun comes out, everyone's getting out and cycling around, everyone's starting to get the sunglasses. But yeah, I mean, obviously there's all walks of life. There's ultra fashion.
Should I try those on?
I think you really should.
I think I should.
This one, I like to call these the Elton Johns.
Yeah, for sure. I think I'm gonna look like a bumblebee, but I thank y'all.
There you go, model there.
Fabulous.
And as with anything, consumables, there's a limitless, amount of selection.
Yes.
What you really have to be careful about is that you're getting sunglasses that are properly UV rated. So what I was showing you earlier, these are just some sunglasses that we got online, personalized with our logo, but we do little giveaways and we do barbecues because we're a very community-based office.
Yeah.
So we kind of give these out to the kids and things like that. But we're also we're leaving our sticker on here, but giving them the warning. Because you can see it says UV eye protection against ultraviolet rays. So being a consumer, you go and you see this little sticker, hey, UV protection, I'm good to go. I don't have to worry about anything. But you have to be careful about the wording. So there's different wavelengths of UV. There's ultraviolet A, B, C, and many more. But A, B, and C are the biggest ones. B is the one that's really, really damaging to the eye. And anything that's not absorbed by the front of the eye is absorbed by the lens inside the eye. And over time, that lens starts to get cloudy. That's a cataract. And everyone will get a cataract. It's just one of those fun things of aging, but we can slow that down.
I didn't know. I did not know that. You said that, mentioned it earlier, that we're all going to get them. We're all going to get cataracts. So
thankfully for us, the technology and the surgeries are so easy now. It's a 10 to 12 minute procedure in and out. It's not. I mean, it's minimally invasive, low complication rate. It really has changed a lot in the last 10 to 15 years.
But another reason why you should be coming to the optometrist to your
100%.
eyes checked,
100%. Because we can see early when starting, we can educate you. Okay,
for sure.
I see a little cataract. This is what to be aware of. These are the symptoms to watch out for. This is how you need to modify your lifestyle. So one of those things, one of the easiest things to do for your eyes, just wear sunglasses. But wear good sunglasses.
Gotcha.
So what you need to do is go out and make sure, when you're getting sunglasses, make sure you ask, hey, what's the UV rating on these? Are these UVA,
Right,
protected?
right. So if you go to an optometrist to get your sunglasses, are you pretty much guaranteed that you're going to be covered for UV?
Yeah, they're going to,
like AB and like you're good.
AB the 100%,
Yeah.
and they will even, and with the optometrist and the optician, their job is when you come in, we get some background information, you know, okay, you're a cyclist. You need more protection than most. We're going to steer you toward these types of sunglasses.
Gotcha.
Or you stare at a computer all day, or you're a truck driver. So different types of protection ratings there. And you want to make sure you get proper coverage. They really just have to be fit properly.
Right.
And then you're going to take care of it.
Awesome. That's great. Well, I think we're good.
I think we're good.
We got it all covered.
I'll show you what could happen if you don't wear the proper sunglasses.
Yeah.
You'll see some scary pictures.
Yeah, some scary pictures maybe.
Shock factor is always good.
He's got some pictures for us.
So this is someone who has a little too much UV exposure, and this is called a pterygium. So it's kind of like
What was the other term for it?
Surfer eye.
Surfer eye.
So this you call it surfer eye because it's very common, obviously, in guys out, surfing or UV glancing off the water and not wearing sunglasses because they're out in the water a lot. So we see this, and it's also very common in people from countries close to the equator.
Oh,
right? Because
okay.
closer to the sun, more
Totally.
UV.
Yeah.
So the farther south you go, the more important it is to wear the proper sunglasses.
Gotcha.
And here is just a good old-fashioned cataract. This is what everyone's lens inside their eye would look like. So this is a patient that's had their eyes dilated, right? That's why the pupil is so big.
Okay.
And that's why you can see that.
So it's very Deadpool too.
What?
Thanks for bringing that up because I won't let
There you go.
And then what they do in surgery, they can actually go inside the eye, take that lens out, and they put a brand new clear lens implant in there.
Oh, wow.
Essentially restoring vision.
There you go.
If
That's what we're all about.
If macular degeneration were only so simple, but that's where you guys come in, right?
That's true.
Leading the fight.
And inherited retinal diseases, redness pigmentosa, Stargardt, all those.
All ages, all walks of life.
But thank you so much for having us.
Thank you guys for coming.
Yeah, absolutely. We're really grateful. So again, we're the shop's at Angus Glen Optometry, right?
Yep, up in Markham.
Shop's up. I get it wrong every time. Sorry.
Shops at Angus Glen Optometry.
Yes, we are in beautiful Markham.
Yep, right
And
across the Angus Glen golf course.
if you'd like to come, what's the website?
It's actually www.angusglenoptometry.com.
There you go.
Google
You can come see Kevin.
And my wife Farhana, she's also the
Yes,
other,
and
the other co-owner.
Farhana.
She's
Yes.
optometrist all in the family.
Lovely. That's great. Thanks so much again, Kevin, and thank you so much for tuning in, everybody.